Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the show. Sorry, Dr. Gwen's not here yet. So you can see where his seat would be if he showed up. I'm sure something patient care related is holding him up to come down to the studio. But we can go ahead and start the show ourselves because we're here on time and we're already getting chat coming in from people like Laura Webb and also Lindsay Antoine, who did a super chat, by the way, which we're super excited about. So, Lindsay, sorry about you having the headache. We hope it goes away. But we also have hello from Tennessee by Laura Webb. And then we'll come back to the chat shortly. Let me just take that off for a moment. While I show you I'm not going to jump right into showing you websites. Let me Google that for you, sort of. Which those words come to mind way more often than they should. Patient will ask questions, and I bite my tongue, trying not to say, let me Google that for you, as I go and use Google on the computer to bring up the answer to the question because it's not medical, what's the address or the phone number for such and such, and I don't know. Let me Google that for you. So why don't we talk about, because this is respiratory virus shot season, which immediately precedes respiratory virus season. Although it's funny that I say that, respiratory virus season. Of course, flu season is coming, and it's pretty well defined what flu season is, and we're coming up on the start of it here before winter really kicks in. And that really applies to influenza and RSV, or respiratory syncytial virus. But as far as a season in the cold months, that's not working out to be the case for COVID. We didn't know what COVID would be when it was hitting us in 2020 and the years immediately following. We didn't know if it would work out to have a season, or if it would just always be a certain level, or if it would just be completely random, how it goes up and down on its incidence throughout the year. But as it turns out, the last 2 years, welcome, Dr. Gwen. Let me give you.
Oh, made it. I got sidelined by one of our PAs.
There you go. Well, hello. Yes, helping out the PAs is important work.
Yes, it is.
We believe in doing that. So I was talking about respiratory viruses and seasons, and about how last couple of years, it looks like the peak of COVID is actually late July, early August. Yeah. So that's interesting. And then I wanted to talk to people about some stats to give some perspective to these viral infections that we're encouraging people to get vaccines against.
Sure.
COVID, RSV, and influenza. Or sometimes referred to as flu. I hesitate to call influenza flu because a lot of times we'll think in terms of a GI
stomach flu,
enteritis or something like that, and they'll call
it
flu or call it stomach flu when it's not influenza. It's not a respiratory virus.
Different
it's
bug.
An enteritis, referring to the lower part of the GI tract. Enteral.
Yeah.
Okay, so we have I should tell you. You should know. We have a super chat from Lindsay Antoine.
Oh.
So that's important. But she has a headache. So
I'm so sorry to hear that.
Yeah. And then we also have Laura.
Send help.
Laura Webb from Tennessee. And then we also have Maureen from Connecticut. Hi, Maureen. Thank you for joining us. We're glad to have you here in our discussion about respiratory viruses. So one of the things I was wondering was, I keep telling patients that COVID, which we're still giving vaccines for, is decreasing in the threat that it is to our health compared to what it was in 2020.
Right.
And in fact, let me Google that for you.
Let me. That's what you want to hear your doctors say. I say that all the time in the
So, oh my God, that is so. I don't know. Can you guys read that at home? You'll have to
that's small.
comment in and tell me. But what I'm looking at here is this is the Google AI summary, but you can see that it's coming from NIH over here on the right, or an NPR story that's probably based on the. And
you clicked on it.
There's the NPR. Probably based on the information from, or at least you would hope.
No longer one of the top 10 causes of death.
Yeah.
But I saw that
so that's a good thing.
The average length of life or life expectancy. That's what I was thinking about. Has returned to pre-COVID levels
already.
Yeah.
That is good news. Okay. So, all right.
Yeah.
So what I was looking at here as far as the deaths is that for the first time, the numbers are still coming in for 2024, 2025 flu season.
Yeah.
We have them for 2023, but for last winter, the last flu season we went through, it's looking like that's the first time that deaths from COVID are less than deaths from influenza.
Okay.
Now, at first glance, I thought, COVID deaths are coming down. And we know that COVID is less of a threat, at least as far as what we see.
From what we're, from experience.
Is, certainly. Yeah. I thought, the rates are coming down, which they may be, but it's also a matter of last year was a bad year for influenza.
For flu, it was really bad last year.
It was bad. So generally, when it comes to influenza pre-COVID, we would think in terms of like 5,000 to 20,000 deaths per flu season, roughly in the United States. It's variable. Yeah. Every year you don't know what you're going to get.
Depending on the strains,
So I thought maybe people would like to kind of see, what are we talking about here? So this is from 2023 data. Let me show it to you here. And number of deaths from, now there's different ways to code for the death. So there's influenza and pneumonia, which is probably a pneumonia secondary to influenza, 45,000 in 2023. Whereas just influenza listed by itself, not saying influenza and pneumonia, 3,975. And in truth, this is an awful lot of overlap as far as who these people are and what's going on. It's people who had influenza and died of something respiratory. Secondary pneumonia that was diagnosed, that would be influenza and pneumonia. The secondary pneumonia wasn't diagnosed. It's just influenza.
And which is still, you can get viral influenza pneumonia.
Yeah.
Or you can get a super infection where a bacterial infection hops on board of a influenza.
So was it that COVID's coming down or influenza's going up? I think it was both.
Well, I think this year. Well, that's from 2023. I mean,
that was 2023 there that I just now showed you.
Yeah. Last year was a little worse than that, I believe. From not last year before last, right?
So we're going with 2023 here now. It's taking another year back. So that's
2 years ago. Yeah, 2 seasons ago.
So I can show you that if you can see this, COVID-19 deaths per 100,000 total population. Usually it's, again, around 5 to 20 with influenza.
Yeah.
And all these light-colored states were 7.2 to 13.7 deaths per 100,000
Eastern
population.
Midwest is.
Yeah, there's just a few places there that were a little bit worse.
In the south,
And really, that's just working out to be the 13.8 to 40, which is a huge range.
That is a huge range.
When before it was the 7.2 to 13.7. But what we're looking at here is in 2023, much, much, much lower numbers than 2020, 2021, 2022. Right. And how much of it is it's a less virulent virus? How much of it is all of the susceptible people were killed off?
That's a morbid way of thinking of it.
2 million people in the first 2 years. Actually, that's not the exact number, but it's
and that's definitely something.
Or was it it was 1.5 million in the first 2 years.
That sounds more correct.
I think that's what, 1 million, not 2 million.
Definitely possible. We know that certain medical diagnoses made you more susceptible.
Yeah, they are.
Susceptible. That's what I'm trying to say. And yeah, so, but there are still people out there who have those same diagnoses who are having their, who are still susceptible as well. And we're still recommending vaccination because it is safe and effective, and there's still people dying. Even though it's gone down below influenza, you know, it's still...
Well, last year.
And yeah, who knows this year? Who knows how influenza is going to be? And who knows how effective our vaccine's going to be this year? Yeah. We don't know that typically till, you know, early spring. So we'll see. And, you know, hopefully we choose right and we can get your flu vaccine and you can be safe. We recommend them.
So we have some comments here from our viewers. We have Lindsay Antwine. Helping to operate in the medical gods may heal the head. Oh, is that what the $25 super chat was?
I see. Wait.
I have to step aside.
Does that mean we're medical gods?
No. I hope that's not what she thought. Okay, Laura. COVID is closed to one of my local nursing homes already this year. Oh, man.
Wow, COVID did that. Probably late summers when that happened. That's when I was really... We were seeing a lot of it. Now, we're seeing
I'm surprised that it's happening now. Although... There
different
is
areas.
COVID going around right now, even still. I mean, it's been always there at a level ever since the pandemic.
It's not like flu where you're like
we're talking about peaks.
In the summer, you're like, yay, no flu. You don't get that with
COVID's not no COVID. It's still there at a low level. So Laura Webb says, she also said, I had asthma and my pulmonologist has told me not to miss the flu shot, but I have taken the RSV. So,
excellent. RSV.
We'll be talking about RSV. I'll show you some information on that. Unfortunately,
thanks for bringing that up. Yeah, those are the big three: COVID, flu, RSV.
Lindsay Antwine, that's awful about the care home closing, Laura. There's already a huge issue finding available care for elderly. Yes, there is.
Oh, yeah,
shortage
absolutely.
Of medical staff, not good. It's so true.
Yep.
And then Laura Webb, especially since our doctors used to visit you in the nursing home or hospital if you were in the nursing home hospital, but that doesn't happen anymore.
They do actually. I believe they're required.
At least around here, they have doctors who go in.
I thought that was a national policy that there's a
there's a requirement. At least here, there's a requirement that anybody admitted to a nursing care facility have either
overseeing
medical provider. It doesn't have to be the doctor necessarily. It could be the PA or the nurse practitioner who actually does lay hands on them within 24 hours of admission or. 48.
It's something like that. I think it may be 48.
And
it's a little
check
less.
on them every so many days.
Yeah.
So there are some requirements for that. And then Laura, Lindsay, have you tried Colpex?
We're giving medical advice.
We'll just sit back and watch.
We'll let you.
I need to act in intercessory capacity for the gods of the mess. Again, I hope she's not talking about that. Thank you for the Dutch brothers that you provide for us.
It's like we're bishops in the field of medicine.
Should be wearing the cardinal
priests.
Red.
Yeah. We will.
So let's look at the RSV situation here. What was I able to find?
RSV. So
with
RSV.
Short notice. Look at RSV.
Did you explain what RSV was? RSV.
Respiratory syncytial virus. And here's something I found from, let's see, what year was it? It was July of 22 to June of 23. And they looked at 1,600 patients aged greater than or equal to 60 years of age, hospitalized with RSV. 54% of those hospitalized over that age were over age 75.
Yeah.
70% resided in long-term care facilities, as we were just talking about. And then what were the risk factors? Obesity, COPD, or chronic obstructive pulmonary disease, and congestive heart failure.
Yeah. So those were interesting ages that you mentioned there as well, 60 and 75, because those are the ages to keep in mind when you talk about the vaccine. For RSV, everyone over 75 is recommended that you get it. And then under age 75 with certain health, and then they're kind of there.
COPD, CHF.
Down to age 60.
I think I may have found some other conditions here.
So if you have any of those, and I think it expands beyond those diagnoses. I think diabetes. I was going to say, and diabetes, because I was going to say, I've given it to people with diabetes.
Yes, absolutely. So that's 4 things.
4
conditions that we think of besides just being over 75.
Right. So make you more at risk. And RSV, we saw a lot of it last year. Last year there was a lot of RSV, and it is one of those that just hangs in there. It is a viral illness that lasts 3 to 4 weeks, easily.
Yeah.
And then sometimes a cough that hangs on even beyond that. And that's typically at best. That's the best part of RSV. At worst, you start to get respiratory issues, end up in the hospital.
Yeah.
Have another infection, hop on board, kind of other things. So.
And I apologize. I was trying to find some relative information as far as mortality with RSV comparing to COVID
see if it's
and influenza, which, as we've said, are kind of neck and neck as far as killing people off. RSV.
It's like it's a race to the
bottom. Yeah. So I apologize. I couldn't find it for RSV. My understanding or my guess would be we're talking lower.
Right. I don't think the death rates
and COVID.
It's very infectious. RSV is very infectious, and
it really depends on how old you are too.
Absolutely.
Which is true for all of them.
Absolutely.
So most of the information that was out there was, of course, RSV in under 1 year of age.
Right. And that's where RSV used to really get the publicity in young kids who will get bronchiolitis or an infection down in the kind of medium-sized areas, airways of their lungs. And that can be severe and even cause death in rare occasions.
Yeah.
My son had that. my middle son. I remember being
very common in the kids.
Yeah, I remember being in the pediatric unit on Valentine's Day because he had. Yeah. That would mean he would have been about 6 weeks old, and that's like the perfectly bad time to get it. Under age 3 months is really where it's
still RSV season.
Yep. He was born in January, so that's really where we see it. So kids are now recommended to get that back. Moms actually get it while they're pregnant.
Just take care of it before they're born.
Yep. And because we can't give it under age 6 months, and I think premature babies get it. I don't do that premature medicine, so I think they do, but don't quote me on that.
Okay, let's see if we have any.
The young and the old; those are the
newer
more at-risk ones.
Or did we already do?
Missed a word. Oh, she said something that missed a word.
I need you to act in intercessory capacity for me, the gods of medicine.
For me, she's the god of medicine. Okay. Just kidding.
Oh my gosh, we're gonna get in trouble here.
The goddess of medicine.
The bottom line, we're encouraging people with those certain health conditions between age 60 and 75.
Yeah, get your vaccine.
Get the RSV shot. People over age 75, please get your RSV shot. And then for the rest of us who are over 6 months of age, get your updated COVID and flu shots.
And you can
before it hits.
You can get all of those on the same day. That is perfectly safe. It may increase your risk slightly of having some side effects, but not decrease its immunogenicity or the ability to mount a reaction.
I don't know if it was after our last show, because we didn't do a show last week, that I got my COVID and
I saw
flu
the video.
shot.
That's right.
Oh yeah,
it was on the YouTube. Right?
Yeah, if you go to
you can check it out.
I guess it'd be the live videos on this channel. You can see me getting my shots.
I haven't got mine yet. Usually I line up with my whole family and we just go down the line.
If you don't do it,
I like them
happen, so get out there
them
and do
to
it.
see me get it first. So lead by example.
See you get it first. And I did have 2 MAs give me the shots who haven't given me shots before, because I have this tradition. All the people who give shots in my office have given me a shot. I believe there's one person who hasn't.
But
there's no. I was going to say I'm up to date, so I'm gonna have to wait till flu shots or COVID shots next time. All right. Anything else on your comments or questions, or Dr. Gawain thoughts on COVID? I guess we should announce what's coming up next week. We are scheduled to have a congressional candidate for California District 3 for U.S. Congress. His name is Tyler Vandenberg. Mm-hmm. He's going for that District 3 seat against the incumbent Kevin Kiley. Congressman Kiley was invited also to be on the show either the same week or another week that works out with his, so we can talk about federal healthcare policies, because that is a big part of what is going on in decisions about where to spend money.
And right now,
anytime they're talking about a budget, a big part of it, one of the topics they talk about is healthcare.
I was just going to say the current talking point on the Democratic side for this government shutdown is Medicare, or not Medicare, subsidies for the
Medi-Cal or
Yeah.
Medicaid, state
Yeah.
Medicaid.
for the Affordable Care Act subsidies.
Yes,
So
yes, with-
it is a consequential thing
Yeah.
that is possibly affecting a government shutdown right now.
Yeah, and I do need to put out one
definitely
piece of
is.
information because some people are misled by a piece of information that's put out there, and that's that the Affordable Care Act premium rates have gone up since it went into being.
yeah.
And so they see that as a criticism of it, but we know that
Since
they
the
were
beginning,
going up at a steeper rate.
You're right. Yeah.
When
I've heard that too.
when it was
saying
put in place. And of course, right before it went in place, really steep because the health insurance companies saw that they needed to do it while they could.
Yeah. That's the thing. We don't have a control here, right? So we saw this
Right.
steep
We don't have
incline,
the
and
United States without
then we had the Affordable Care Act, and it kind of still went up, but at
Still
a
went up.
less increased rate. But we don't know how things would have gone before. It could have going up at a even steeper rate before. There's no control. So
Unlikely that without it, it would have flattened with the way things were going.
yeah.
The tradition or the trend was that the prices were going up
Yeah.
each year, and that's why they came up with it.
Right.
So, and now we're going to possibly see what happens without it.
I guess so.
Yeah. So
If they don't.
that
Extend
may
that
get some people's
resolution.
attention.
Yeah,
All
we
right.
will
So
see.
thank you for joining us. And next week we will be talking about federal healthcare policy with Tyler Vandenberg.
All right.
Again, the invitation is out for Congressman Kiley to join us. Also, we'd love to talk to him about.
Oh man, both of them here at the same time.
Well, or separately. But we'd love to talk to both. of them.
We will. Yeah.
So until next time,
Hey, I'm Dr. Wayne Bond.
Dr. Mark Vaughn telling you to stay in good health. And thanks for joining us.
Get your vaccine.
Yes.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.